Hey guys, just adjusting the volume here. Need to get this one going. How are you? I'll wait a few more seconds while everybody logs on. For those of you that have been following me on a weekly basis, this is Dr. Tolentino from EliteHealth. I am one of the physicians here, the general practitioners. I am also certified in bioidentical hormone replacement and optimization. This is basic hormone knowledge at this point, and of course, if you have any further questions regarding the things I discussed, you can feel free to see me here at the office. You can also, visit and talk with your doctor and discuss the things that I talk about. You can see other doctors that are well versed in hormone optimization, but it's very good basic knowledge for both you and everybody else out there that has issues or symptoms of hormone imbalance. The last Periscope I did last Wednesday at 5 o'clock mainly discussed thyroid definition, thyroid hormones, thyroid symptoms when patients have low thyroid levels, mainly hypothyroidism. This next Periscope, the one that I'm doing today, is mainly to talk about the supplements and the things that are good to help you have an active or healthy thyroid. The thyroid gland, again, it's right here in the neck, and it does emit a lot of hormones that are responsible for temperature control in your body, like the homeostasis of your actual body temperature. It has hormones responsible that help with issues with your weight, with metabolism. Some symptoms of patients that have low thyroid or a thyroid that's not functioning well would be cold intolerance. Feeling cold hands or cold feet are usually the signs that begin. Sometimes patients have issues with fatigue, feeling tired most of the time throughout the day, sometimes even just in the mornings. Also, patients have symptoms with hair shedding or hair thinning. That's also important to note. And symptoms of weight gain, unexplained weight gain. So those are some major things. I do see a lot of patients that have symptoms of adrenal fatigue or adrenal issues, things that have to do with their cortisol levels and so forth. And of course, other hormones like the adrenal gland hormones like cortisol do affect your thyroid. And thyroid hormones do affect your estrogen, testosterone, and progesterone. So as I've said before, it needs to remain balanced. You need to have hormonal balance with everything. A lot of things are based off of not just symptoms, but levels and medical conditions or issues that you have. But there's a lot of things that could be affecting how your body is reacting, whether it be aging or natural aging, that starts to bring on a lot of the symptoms of hormone deficiency or hormone imbalance. So feel free, if you have any general questions, you can always email me at jt@elitehealth.com, and you can also discuss anything that you need to, like via email, or you can come see me here at the office and also discuss it here with me too. So the main thing to touch base on today are the types of supplements that you need to help you keep a healthy thyroid. For example, probiotics, I would probably start there, and a lot of books that I read that talk about supplements for thyroid, they do start off with probiotics and how important they are. We're starting to realize in the digestive tract how important they are for patients, not just with digestive symptoms, but digestive symptoms in the gut that could be correlating with other symptoms or other issues. So probiotics is very, very important one. And it's a difference because probiotics actually help your thyroid convert the inactive form of thyroid to the active form that your body needs. So if probiotics are helping you do that, or taking them on a regular basis, they're also doing important other things that you need, especially for everyone's bodies. So I encourage all of you to start to take probiotics on a daily basis, because it will help balance out the gut flora and help normalize issues there. And at the same time, it is helping you to convert the inactive thyroid hormone, like the T4, into the active T3. So that's very important. A lot of reasons why people should always be taking a probiotic, I would suggest or recommend, because people are on medications that do interfere with absorption. So some of the most common medications that a lot of people start to take that interfere with the absorption in their GI tract. So anything you're taking that's orally, anything that you're taking for like medications such as antibiotics, steroids. Sometimes patients take prednisone or sometimes we doctors prescribe Medrol dose packs and those types of things. They interfere with the gut flora. They interfere with absorption. They're also interfering with your thyroid indirectly as well. Antacids, let's see, we're also looking at, let me just turn that off. We're also looking at things like acid reducers or acid blockers, those types of things, those types of medications. We often prescribe omeprazole. So these types of things, you know, if you are taking them, you should at least also take a probiotic with it to also help protect your gut, your GI tract from decreased absorption. Birth control pills. A lot of younger women and even older women are on birth control pills. Those are synthetic estrogens that are also very important, and they do affect the gut flora and absorption. They also will affect whether or not your body is able to absorb not just that specific medication, but even other medications, so it's important to note that too. Blood pressure medicines, those types of things, even alcohol, sodas, which we want to stay away from because they're causing a lot of inflammatory issues and issues with sugar, like I mentioned before. So we want to make sure we stay away from that too. Another supplement that's going to help with our thyroid, it kind of goes into a group, would be the B vitamins. Vitamin B6 and B12, most importantly, do affect the thyroid functioning. So it's very important for you to be taking B6 or B12. A lot of supplements out there have multi-level complex ones where they're including different amounts of the different type of B vitamins. So if you do get one, make sure B6 and activated B12 are a part of that. B12 is interesting because there are genetic issues or genetic defects that keep people from absorbing B12. And you think about the GI tract and GI issues, if people have digestion or absorption issues, that's going to affect it as well. So methylcobalamin or activated B12, a lot of people have an easier time absorbing or using that type of B12 because it does bypass any sort of genetic defects that people have. So methylcobalamin, the activated form, is very important for your thyroid. So they noted, they've done a lot of studies, tons of studies, where they show that people with B12 deficiencies and even B6 deficiencies, they start to develop hypothyroid type symptoms. So it's important for you to have a healthy thyroid, and you can help use these types of supplements that are used for many other purposes and not just your thyroid to help it function the best. So it's important for that. Iodine, we talked about iodine before. I think I had mentioned it in the previous lecture, but iodine is also important because it's what you need in order to make your actual activated thyroid hormone. You do need iodine in your body. It's important for the levels to not be too low or too high because people can develop symptoms from that as well. But we do most of the time get adequate iodine, at least here in the US. We do get adequate iodine, and there's also things that help stop us or keep us from absorbing or having adequate levels of iodine. So having a good baseline level of iodine is important. Two of the more common ones that we note to help with our thyroid would be selenium. Selenium, and I've also read frequently about ashwagandha, those two. So ashwagandha I know is great because it's actually an adaptogen. It is almost like a pro-hormone for your thyroid, I guess I would consider it. And it does a lot of other things too, because it's not just helping out your thyroid, it's also helping your adrenal glands. So a lot of cortisol or cortisol-inducing to help cortisol level supplements, a lot of times they include ashwagandha to help the adrenal glands function better, which in turn also help your thyroid function better. So ashwagandha is very, very important. It does help you stimulate, it does help the body stimulate the production of your thyroid hormones. And remember, the most important one was the activated free T3. So that's one of the levels that your doctor should be checking for when they're checking to see how your thyroid is doing. Selenium, usually 200 micrograms at a minimum dose is really the recommended for selenium. So a lot of supplements that people use to help enhance their thyroid functioning have at least that minimum dosage of selenium in it. So that also helps your body convert the inactive thyroid hormone into the active free T3 that we need. That's important because it's not just doing it at the level of the actual thyroid gland, but it's doing it at the tissue level as well. A lot of these things are not just happening in the gland, like I've mentioned before, they're also happening in your tissues and oftentimes even in the liver. That's where a lot of your thyroid hormone is actually converted into the active form. So it's important for you guys to know that too. Those, what I say, are the most important ones. I do see that a lot of supplements also include at least baseline dosages of zinc. So zinc would be another good one. We also use zinc a lot of times for our immune system. I know some of you, when you start to feel under the weather, you get Zicam, which is higher doses of zinc. But on a daily maintenance dose of a lower form, then that's okay, usually about 50 milligrams, once or twice a day. Some patients start to take that as well. Here at EliteHealth, Elite Fit Forever has a supplement called Metabolic Support. It looks like this. Metabolic Support does have iodine, selenium, some of that ashwagandha, and also L-tyrosine. So these are some of the main things, or the main types of supplements that we would also include for a patient who wants to enhance the functioning of their thyroid gland. Make sure you discuss these types of things with your doctor, and if you're starting to develop any of the hypothyroid symptoms, like I mentioned in the past, you should discuss this with them as well. A lot of the same types of symptoms kind of correlate with adrenal glands and also your thyroid gland. So if you're starting to develop those types of symptoms, like the fatigue, any issues with brain fog, depression or anxiety type symptoms, weight gain, the cold intolerance with the cold hands and the cold feet, those types of things. If you're starting to develop any of those symptoms, make sure that your doctor does investigate your thyroid, and like I mentioned before, looks into not just one marker for your thyroid, but more than that. You should be checking at least 3 or 4 different markers, and sometimes even the antibodies and so forth. And even it's very important to make sure they're also looking at the other hormones, so the adrenal gland hormones as well, and the sex hormones, because they are all important and they all need to be equally balanced. And when one is off, it does throw up the balance of the other ones. So yeah, I think that's it for today. We will touch base on the different types of foods that are important to help your thyroid, as well as the other endocrine glands. So we're going to talk about that next Wednesday, the different types of foods that are important to at least help your thyroid and other important glands function the best as possible. If there's any other questions or any suggestions you guys may have on topics, feel free to let me know. I think 2 weeks from now, I'm going to touch base on memory loss and the types of supplements that are important for memory loss. And we'll go through the schematics and how those affect your body and the types of things that they can help with, not just with memory, but for other reasons. So I will touch base and see you all next Wednesday, 5 o'clock. And if you have any questions, feel free to email me. Have a good day.